What are the long-term consequences of internet addiction? Have you ever wondered what happens to our brains and lives when we spend too much time online? Internet addiction, also known as internet addiction disorder, is a behavioral condition that can lead to serious long-term consequences. This condition is marked by excessive and compulsive internet use that disrupts daily life. It is not just about spending hours online. It can lead to significant negative outcomes in personal, social, academic, or work life. The neurobiology of internet addiction reveals that chronic use can change brain structure and function. Research indicates that heavy internet use can alter the brain's gray and white matter. These areas are crucial for thinking, emotion, and impulse control. Over time, these changes can make it harder for individuals to manage impulses, focus attention, or regulate emotions. Dopamine, a neurotransmitter associated with pleasure and reward, plays a significant role in both substance and internet addiction. When people frequently use the internet, it can trigger dopamine surges. This reinforces the behavior, making it increasingly difficult to stop. As tolerance builds, individuals may find they need to spend more time online to feel the same satisfaction. When they cannot access the internet, they may experience withdrawal-like symptoms, such as anxiety, irritability, or depression. The psychological and social consequences of long-term internet addiction can be severe. Many people develop issues like depression and anxiety. Some may even experience symptoms of other mental health disorders. While the internet can connect us, excessive use often replaces face-to-face interactions, leading to social isolation. This isolation can create a cycle where individuals turn to the internet to cope with negative feelings, further deepening their loneliness. Academic and occupational problems are also common. Individuals may neglect responsibilities at school or work, resulting in poor performance, missed deadlines, or even job loss. Over time, these issues can damage self-esteem and limit opportunities for personal growth. Physical health effects are another concern. Prolonged internet use often leads to a sedentary lifestyle. Sitting for long periods can cause weight gain, muscle stiffness, and back pain. Eye strain, headaches, and repetitive strain injuries, such as carpal tunnel syndrome, are also frequent complaints. Additionally, lack of physical activity and disrupted sleep patterns can harm overall health. Certain factors can increase the risk of developing internet addiction. Existing mental health conditions, loneliness, and a lack of social support can make individuals more vulnerable. Stressful life events, such as job loss or major changes, can also trigger problematic internet use. Understanding the neurobiology of internet addiction helps explain why it can be so challenging to stop. Treatment approaches often mirror those for substance use disorders. These may include behavioral therapies, support groups, and sometimes medication for co-occurring mental health issues. Encouraging regular breaks from screen time, engaging in physical activity, and fostering real-world social connections are practical steps to reduce risk and support recovery. In summary, internet addiction can lead to lasting changes in brain structure and function, emotional and social difficulties, and physical health problems. Addressing this condition requires a combination of behavioral change, social support, and, when necessary, professional treatment.